Hey everyone, welcome to Question Period Rewind. I'm Donna Skelly, the Speaker of the Legislative Assembly of Ontario. Let's go back to 1986. That's the year when the Rock and Roll Hall of Fame inducted its first batch of musicians. Among them, the iconic Ray Charles, Buddy Holly, and of course, Elvis Presley. Tina Turner was also receiving praise in California, where her star on Hollywood's Walk of Fame was revealed. And if you turned on the radio, there's a good chance you'd hear Madonna's #1 hit, Papa Don't Preach. But now, let's tune into the conversations the MPPs were having in Question Period.
Oral questions. The Leader of the Opposition. Order, I'm sorry. Point of order. Point of order.
I thought that this government indicates to all the two opposition parties when any visitors are coming in.
Order.
I thought that.
Order. It's not a point of order. I'm sorry. Order. Order. Oral questions. The Leader of the Opposition.
Mr. Speaker, my question is for the Premier, who was able and willing, apparently, to answer questions related to the doctor strike outside the House yesterday, while he refused to do so inside the House. I would hope that this afternoon he would deem himself worthy of answering questions to members of this Assembly. In so doing, I am sure he has by now been briefed by his health minister with regard to exactly the size and scope of what is becoming a very frightening circumstance throughout Ontario. With that in mind, would the Premier inform us this afternoon how many emergency wards are now closed, how many elective procedures have been canceled, how many medical advisory boards have resigned, and how many hospital boards have resigned?
Premier?
Mr. Speaker, we have some information with respect to that. I think the Minister is in a better position to give you up-to-minute details than I am, but if the Honourable Member is so intent on asking me a question, I'm happy to answer to the best of my ability. And then if you're not satisfied, you may want to ask him of his of any up-to-date information. But I just, it's an interesting discussion you're putting here. I remember, and I refer you back to April 27th, 1982, when the very same question was asked to the same minister. Well, just a minute. You may want to read this. And I asked you the same question, and you said, as the Minister of Health, you couldn't be expected to know these situations. You couldn't be expected to know what hospitals were closed down or how many elective surgeries have been canceled. You were the minister, not the Premier, on that occasion. It's interesting how you keep changing your views on these situations. But, Mr. Speaker, to the best of my knowledge, it's the following situation. Welland County General, 12 noon Monday. Scarborough Centenary, 12 noon Monday. Peel Memorial, 6 o'clock Monday. Humber Memorial, 4 o'clock Monday. Reopened at 8 o'clock today. Etobicoke, 6 p.m. today. Queensway General, 6 p.m. Monday, in rotation with Peel, Credit Valley, and Mississauga General. York Finch, today at 8 a.m. Sarnia General, today at 9. Joseph Brant Memorial, Burlington, today at 8 a.m. Plummer Memorial, Sault Ste. Marie, today at 3 p.m. York Central, Richmond Hill, today at 8 a.m. Ajax Pickering, today at 12 noon. Cornwall and Hotel Dieu General. Physicians have voted to withdraw service from these hospitals on an alternating basis, beginning with Hotel Dieu. I gather today, I'm not sure about that. Scarborough General, Wednesday at 8 a.m., Credit Valley, Mississauga, in rotation with Peel, Queensway, and Mississauga General. And I think I've answered your question to the best of my information at the moment.
Supplementary.
Well, the Premier referred to April 27th, 1982. And I want to read to the Premier the question he, as Leader of the Opposition, asked me as Minister of Health. And I want to remind the Premier that on April 27th, 1982, we were talking about day one of a 2-day strike. In 1986, we are in day 6 of a strike which has included the closing down of emergency wards. I want to read to the Premier the question he asked me.
Tell that to your constituents.
The very question he referred to. Will the Minister agree that he does not have the devices available to gather this information and that he does not know the extent of the crisis? Given that and the evidence we in this party are receiving, does he not feel it is time to bring in back-to-work legislation? We will cooperate with the Minister in that regard to make sure he has the weapon available to him to prevent a serious tragedy which we would all regret. Now, my question to the Premier is this. If on April 27, 1982, on day 1 of a much more modest strike than he faces in day 6 of a very serious strike,
Question,
if on
please.
day 1
Question.
you were worried about a serious tragedy occurring, why aren't you worried about a serious tragedy occurring
Premier.
now? And why aren't you
Order.
doing something about it?
Premier.
If it is now the honourable member's position that we should bring in back-to-work legislation, then I'm very interested in knowing that. I appreciate knowing from hour to hour what your position is, because it's very hard to determine from any rational understanding of the situation. But that's what you're saying. Now, let me just say, these closures that I've reported to you on the best of our knowledge on an up-to-date basis are, in a sense, partial closures. Those emergency rooms are still open. There is a doctor there. And you will be aware that nurses are there, paramedics are there, a doctor is there, taking primary responsibility and referring some of the less serious cases to other areas that are open. The Ministry has an emergency plan in place, and I'm sure the honourable member will be aware of that. It is functioning. I grant you that there is an inconvenience at the moment, but I can assure you the Ministry is watching it very, very closely, and at this moment we are proceeding on the course that we have suggested.
Final supplementary.
I want to tell the Premier that with thousands, tens of thousands of people, this is too serious a matter for those kinds of games over there.
Order. Order. Final supplementary.
The Premier has assured this House that the Ministry has an emergency plan and available. We called the Ministry of Health number this morning, which the Minister gave out as his emergency plan. What happens when you call the Ministry of Health number as his emergency plan is, unbelievably, the Ministry of Health tells a caller to call their doctor or to go to the nearest emergency ward. That's the Ministry of Health's response to this chaotic situation we have across this province. My question to the Premier is this. He has described the situation in emergency wards and assured the public that there is one doctor and some nurses on hand and that there is a selection being made. Is the Premier comfortable with the circumstance in which, having created a battlefield out of our emergency wards, there is a triage going on where a doctor is making a selection with regard to who's going to be treated and who isn't going to be treated?
Premier.
As Premier of Ontario, are you satisfied with that triage in our
Order.
system?
The question's been asked.
I say to my honourable friend that the Minister and his staff gave very rational and sensible advice to people. You see, he's not into, as the Ministry isn't trying to create a panic, as some other people would attempt to want to do, perhaps. Because the reality is there are a large number of physicians still operating in their offices. And you know the odds as well as I do, if one phones one's physician, that he or she will be there. Number two, if his or her physician, what do you mean it's not good enough? It's very sensible advice. It may not be sensible for someone who wants to create a situation.
Order.
If you'll listen, the second point is this.
Order.
The second point, and I think the minister announced this, is if emergency care is required, an ambulance can be called, and the ambulances are aware of which emergency wards are open and which are not. Thirdly, one can call the College of Physicians and Surgeons that gives advice in this matter. And fourthly, there is a hotline number to assist people that can't get advice or assistance through the first two or three methods. It's very sensible, and I think, frankly, when people understand that message, they will understand that the ministry is on top of the situation. Now, I recognize others would like to create panic and situations that incite fear in people, but I can tell you it's not justified in the circumstances. And I would say to my honorable friend, if he wants to assist in this situation, why doesn't he help pass the legislation rather than stonewalling and delaying it?
New question?
Yes, my next question is for the Premier as well. He suggested ways to assist the situation. I wanted to read to him the comments of Dr. Railton last evening, and again repeated in the morning paper, where Dr. Railton says, if the legislation is passed this week, the doctor strike and protest actions will continue. Therefore, if the Premier is if the Premier is serious about wanting to stop this problem and solve it, I have a proposal for the Premier.
By way of question, I hope.
By way of question. Given the fact that one phone call to Dr. Railton can stop the strike, I have here a telephone. I have here a telephone. I have here
Order. 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 If the members want to waste the time, that's fine. Supplementary immediately, please.
I have a phone. I have a portable phone here. I have a portable phone here. We have.
Order.
That attitude, Attorney General, caused this strike. That's right.
Order. 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 No. Order. I'm just going to wait. It's your time you're wasting. Order. Order. Supplementary. Immediately.
I haven't asked the question. The first question hasn't been asked.
I'd like to hear the question.
Well, they haven't let me put it.
Order. Heard. Order. Order. Question.
I have.
Point of order.
Attention to you, Mr. Speaker, I'm sure you're well aware of it, and the members of the standing orders. And it says, in putting an oral question, no argument or opinion is to be offered, nor any fact stated except so as may be necessary to explain the same. And in answering any such question, the member is not to debate the matter in which it is referred to. Now, I suggest to Mr. Speaker, to you that telephone that telephone that the honourable member has is encouraging further debate on the matter.
Question?
We had Winkin yesterday. We have Blinken and Nod today. Winkin, Blinken, and Nod are in charge of our health care.
Question?
I have a telephone for the Premier, and we have programmed into it Dr. Railton's phone number, where he is this afternoon.
You can use it.
Now,
All you got to do is push a button, Dave.
I say to the Premier, with havoc in the healthcare system, if he will push this button, he can speak to Dr. Railton. He can speak to Dr. Railton.
Order!
And the doctor's strike will end simply upon requesting a mediator. I'm going to send the phone over to the Premier.
Order. The question's been asked. Order! Order!
Pressing that button.
The question's been asked.
Thank you,
Order.
Speaker.
Premier?
I thank the honourable member for his suggestion. It's a better gift than the chicken that I received from the honourable member from Welland some time ago. But let me say it, because this is a serious matter, and I want to say to the honourable member that, Mr. Speaker,
Order.
This is a very serious matter, and we believe that the ministry is looking at the situation, monitoring on an ongoing basis. If it was as simple as one phone call, let me tell you, it would have been done months ago. What you're asking me for is to withdraw the bill. And I think if you should want to stand up and tell what your real view is in this situation, not a phone call. And I think the minister will be aware of that. And if that's your position, I respect your position. If it isn't your position, why don't you pass it? See, the way you could be most constructive is use this phone to phone your House leader and tell him to get on with a discussion of this bill in this House.
Supplementary?
We don't have to call our House leader. This party is united in trying to stop you. Trying to stop you. In trying to stop you from destroying the system.
Order! 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 Order. Supplementary.
Didn't know you cared, Vinny. The spectacle of laughing, joking, smirking, and more blinks today on that side of the House is scandalous when patients are waiting for heart surgery and cancer surgery. That's your response to the strike. My question to the Premier is this. He claims that there's nothing he can do to stop this strike. Let me ask the Premier this question. Dr. Railton last night answered this question posed by Denise Harrington. What are the OMA's conditions for ending the strike and restoring service? The answer? All the government has to do is consent to meet with us in meaningful negotiations. That was his answer.
That's all you have to do.
You have described the situation as a grade 8 high school dance with no one prepared to make the first call. Might I say on behalf of thousands of struggling patients, scared parents, will you make that phone call today?
Premier.
Mr. Speaker, first of all, I think as legislators, we all have a responsibility not to put more fear or panic in the hearts of people than may be there now in a difficult circumstance, and I think we all have a responsibility in that regard, including you, and I know you'd want to fulfill that responsibility. Secondly, and I'm not sure of the exact words, but my understanding of Dr. Railton's position, and I watched that debate with great interest yesterday. And I say to you, I thought that was democracy at its finest. I thought it was an excellent debate, an excellent discussion of the issues. I think Dr. Railton put his position very well, and I think the minister put the position extremely well. And I say to you, because this is the big issue. I hope that every single person in this province saw that debate last night, and then let them judge, and then let the people of this province judge. And my sense is that the vast majority would support the Minister of Health in the cogent and thoughtful way he put forward the arguments to end extra billing. Now back to the point. It is a phone call, and if it was so simple as to end it with one phone call, to strike with one phone call, I would do it. But that is just not the case. See, they want us to withdraw the bill. And I can tell my honorable friend, you know, we are not going to withdraw the bill. We are going to proceed with the bill. We have offered, Dr. Railton acknowledged on television last night that the negotiating team, led by the minister, put forward a number of very constructive proposals. There was even a letter back, yes, he did, and there was a letter back to the minister by one of the teams saying that we are making real progress, and we're prepared to sit down with the medical profession very shortly, today, and discuss a number of the issues that are outstanding. There's no question about that. But you see, you can't bend in every little breeze, Mr. Speaker. We said to the people of this province where we stand on extra billing, it's a very difficult situation at the moment, not one I'm happy about, believe me, and I wish this was not happening. But I can tell you, we are fulfilling a commitment we believe in.
Order.
I don't think it's...
Order. Final brief supplementary.
Same as the final brief answer, or the final brief yelling and screaming that interrupts this House all day? Well, that's exactly what you're doing.
Final supplementary.
The Premier, with respect, misrepresents what Dr. Railton said on TV last evening.
Right.
What he categorically said was so-called negotiations conducted by the government. What he categorically said was he would like the legislation postponed to allow an opportunity for meaningful discussions. My question to the Premier is this. He may not think it's a frightening situation, but I want to tell you how I exercise my responsibilities in this House.
Question.
I, Premier, am frightened about what's happening in the healthcare system. Like you on day one in 1982, I think...
Order. Do you have a question? Question.
Is the Premier convinced that there is an acceptable level of healthcare services available to the public of Ontario today?
Premier.
Chairman, Mr. Speaker, to the honourable member, in your first supplementary, you suggested that just one simple phone call would solve the problem. Then your third supplementary, or your second supplementary, you said if the bill was postponed. I wish you'd given me full information in your first supplementary. Well, Mr. Speaker, when you're representing someone saying, I'm not playing games, Mr. Speaker. You know where I stand, Mr. Speaker.
Order. Order! 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 New question, the member for York South.
Speaker, the definition of a Tory phone is one that has one number on it, that of the OMA, and it's a one-way line. Mr. Speaker,
You're not doing anything to help it. You're not doing... Well, you finally come around, Alan. Nice to have you back, Alan. Nice to have you back, Alan.
Order! Order, I'm just going again once. Again, wait. Order. Order. New question.
should be an Oscar for synthetic indignation.
Question?
Should be an Oscar for synthetic indignation, Mr. Speaker. I have a question for the minister. I'm concerned about another phone line, Mr. Speaker, and that's the phone line that appears to have been operating over the last number of years between the OMA and the College of Physicians and Surgeons. I'd like to ask the minister if he can explain why in 1982, after a very short stoppage, on April the 28th, Dr. Klotz, who at that time was the president of the College of Physicians and Surgeons, wrote to every member of the college and said, and I quote, "In the opinion of the council, further interruptions in the services provided by individual physicians do not serve the public interest. The council is concerned that further disruptions of longer duration would have serious implications for the health and welfare of those who need medical attention." I wonder if the minister can explain why that letter was sent out 4 years ago after a very short disruption, and we had a statement yesterday which simply said that the complete closure of emergency departments is unacceptable, which clearly appears to imply that the rotating closure is in fact acceptable to the College of Physicians and Surgeons.
Mr. Speaker, I cannot tell you about, or the members of this House, about what the people did in 1982. I can tell you that the college has been quite active in reviewing and monitoring the situation, and in fact has been on the scene in a number of the locations, meeting the needs of the delivery of service in those areas. I can tell you that they have developed for the first time a statement with respect to the delivery of services on a service basis rather than on an individual physician basis, and I think they have set out the principles very clearly of the requirement to deliver service in those emergency departments.
Supplementary?
Speaker, Dr. Myers, the past president of the OMA, is quoted in an article today in the Globe and Mail and stated as follows: that as a result of a letter sent by the OMA to the college, the OMA pursued the subject in correspondence and in meetings with the college. The college has now, quote, rethought its position, he said. It was all straightened out in 1982. Mr. Speaker, I'd like to ask the minister, is he aware of that statement by Dr. Myers, and what steps has he undertaken as minister to find out precisely what correspondence and what meetings and what understandings have been reached between the OMA and the College of Physicians and Surgeons?
Minister?
Speaker, I can tell the honorable members that I am aware of the statement as reported in one of the dailies here in this city. I can tell you that the registrar, Dr. Dixon, has contacted the reporter who broke the story as well as others. I also called him early this morning and talked to him about that, and was told that in fact there is no understanding, either formal or informal, that is being indicated by Dr. Myers. There is in fact an understanding and an indication by Dr. Dixon that the college takes its responsibilities to ensure the public interest very seriously, and that they regard the upholding of the regulations under the Health Disciplines Act as their solemn duty, and in fact they are going to undertake that.
Final supplementary.
Mr. Speaker, there is a dramatic difference. Any, I think, objective observer would agree, a dramatic difference between these two pieces of paper. One of them sent out in 1982, and one of them sent out in 1986. Everybody would agree that what's going on today is far more serious than what took place in 1982. If the explanation isn't collusion between the OMA and the College of Physicians and Surgeons, can the minister explain why the response from the college up until now has been so pathetically weak with respect to the disruption of services?
Minister?
Well, Mr. Speaker, I have to say that the college has performed their function, I think, in this particular situation very well. They have had people on site on those locations. They have talked to people. They have counseled people with respect to questions which have come in. They have established a very public preference, and I can tell you that in fact the honorable gentleman has indicated that the college has caved in. They have not caved in. They have been very serious about pursuing the public interest, and Dr. Dixon has assured me that they intend to pursue the public interest, and I think that we will see that they will pursue that public interest.
New question, the member for York South.
The college is not doing what it did in 1982 when there was a much shorter disruption of services, and it ensured all emergency services would continue to be provided. The minister has not yet provided us with an explanation. If you can't explain that, can you explain why the college has not, in any of its publications or in any of its statements, made any referral at all to either the Health Disciplines Act explicitly or to the Public Hospitals Act? Why there's been no reference to the fact that doctors who are on medical staff of a hospital are supposed, to quote again the section of the Act, supposed to arrange for another member to perform his duties and notify the administrator. Can you explain why the College of Physicians and Surgeons is not informing the medical profession what the law is in the province and why it does not appear prepared to enforce the law in the province of Ontario?
Mr. Speaker, the registrar of the college has indicated very clearly that the college will enforce the law, that they take their mandate very seriously, and in fact they have been working quite closely, not only with the Ministry of Health, but particularly with the staffs of the hospitals and, in addition, the boards of those hospitals to underscore the requirements under the regulations. And Dr. Dickson assured me personally today, and I spoke with them early in the morning and I spoke again at noon, that they are pursuing the enforcement of the Health Disciplines Act regulations, and they will not be deterred from that. There is no collusion, there is no agreement.
Supplementary.
Mr. Speaker, the minister really is spouting nonsense. The fact of the matter is you have hospital emergency wards being closed right across parts of Metro and in the areas around Metro. You have it happening in Sarnia, in Welland, in Cornwall, and the College of Physicians and Surgeons has said virtually nothing with respect to how they feel about that particular action by those doctors. I'd like to ask the minister, what does he intend to do? If the college isn't prepared to act, what does he intend to do about a statement by Dr. Sky, who's the OMA representative at Etobicoke, who said doctors, and I'm quoting, doctors are not listening to the OMA directive, and they are doing whatever it takes to get the government's attention. Quote, it's getting pretty hard to coordinate the hospitals to ensure there is public safety at all times. Mr. Speaker, it's clear that discipline in this situation has entirely and utterly broken down. The OMA is condoning this action, indeed, in parts coordinating it. The college is sitting back and doing nothing and condoning it and saying the closure at Northwestern is okay as long as the other ones follow that pattern. There's no problem.
Minister.
If they're not prepared to act, what steps is the minister prepared to take to make sure that patients continue to have access to emergency services in the province?
Mr. Speaker, I think the honourable gentleman said that the college was condoning this sort of activity, and I can tell you that the college is not condoning this sort of activity. They have been, Mr. Speaker, on the scene in a number of areas and have done a lot of work to ensure that there is the medical services available at each of these emergency rooms, which have been reported to be closed, that in fact there are people there delivering medical judgments, which is, of course, the way in this province when medical necessity is shown. Medical judgments are being delivered, and I think the college has had a very large role to play in making sure that there has been the provision of services in this province. I can tell you that the college has not got an agreement or otherwise with the Ontario Medical Association whereby they have decided not to enforce the regulations. That's just not an appropriate reading of the information. I can tell you that they have undertaken very clearly and very strongly to me that, in fact, they will enforce the regulations, that they are enforcing it, and that they are taking practical steps to ensure that there are services in these emergency rooms.
Final supplementary.
Mr. Speaker, we'll do it every day if we have to get this minister to act. Mrs. Yvonne Piter is a resident of a senior citizen home in Hamner. She apparently has bladder cancer and was told that surgery was needed immediately. The cancer has to be cauterized. She was scheduled for surgery at the Laurentian Hospital, and she's now had her operation put on hold. The woman is in quite a bit of pain and discomfort and now has to wait for the surgery and doesn't know when it will take place as the Laurentian Hospital has canceled that surgery. Mr. Speaker, that is happening. I'd like to ask the minister, is it his view that that is lawful under the Public Hospitals Act and under the Health Disciplines Act? And what do you intend to do about this example and literally dozens of other examples of people who have had cancer surgery delayed, heart surgery delayed, and are not getting access to the services which their doctors in the so-called sacred doctor-patient relationship are supposed to be wanting to maintain and to uphold in the province of Ontario?
Mr. Speaker, again, I have asked the honourable members of this House that when they know of situations like that and of others, that they advise me so that we, in fact, can take the steps. I know that the honourable gentleman was aware of situations which were brought to my attention before, and there were steps taken to ensure that there was delivery of service. I can tell the honourable gentleman, I can tell the members, and I can tell the public that the college will take steps to intervene in those situations.
Order. New question? Point of privilege?
I really do think that the minister has abused my privilege as a member, because I had referred to the minister a specific problem one of my constituents had, and unlike what the minister says, that problem has not been solved by either the college or the minister.
Order. Hardly a point of privilege, but it's certainly a point of view. The member for Cochrane South, new question.
Thank you, Mr. Speaker. My question is to the Premier.
Beg your pardon? After the two leaders' questions, it must start with the official opposition and come around. The member for Cochrane South.
Nice tactic.
Mr. Speaker, my question is to the Premier with respect to the current situation and withdrawal of services across the province. And I know that the Attorney General was enjoying himself and laughing about this situation, but there has to be some concern somewhere in this government about what's happening to the healthcare system in this province. It is not in hand. It is not in control. It's totally out of control, Mr. Speaker. I'm talking about cancellation of surgeries for cancer, for the removal of fibrous growths, and I know what I'm talking about. I'm talking about 16-year-old children who have had necessary treatments for asthmatic conditions canceled. I'm talking about a 60-year-old man who sat in a hotel room in Toronto for 3 days waiting to be admitted with a cancer operation. My question is,
Come on.
these are references, these are referrals from all parts of the province, into the medical centers of our province for needed medical attention, for needed surgical procedures. They're being forgotten in all of this. What are you going to do to guarantee them proper access to medical care in the province?
Premier?
I think the honourable member, puts the situation well. There is a hardship. There's no question about that. I don't know the specific cases he refers to, but I can assure you that the minister will pursue those if you're prepared to share with him. We are told that emergency surgery is not being canceled, and that medical judgments are being made in that regard, and presumably they are elective surgeries, and I'm not in a position to say one way or the other in that regard, but I trust the professionals to make those judgments. And that's the position of this government. Now, with respect to the urgency of the situation, I think where the honourable member could be constructive is to persuade his party to proceed with the bill. And if you could use your good offices to do that, and the senior voice that you have in your caucus to proceed rather than stonewalling, I think we could have a resolution of this question.
Order. Supplementary.
Mr. Speaker, the Premier knows very well, based on the comments that my leader just made, that will not happen. The speeding up of Bill 94 will not solve this problem. It will not deal with the backlog. Well, you try negotiating with them for a change, you turkeys. Try negotiating.
Would the member take a seat? Order. Would the member take a seat? Order. I can wait. I was hoping a number of members would be able to ask questions. Order. Supplementary. And please direct it through the chair to the Premier.
Yes, thank you, Mr. Speaker. Can the Premier confirm that there is no medical assessments taking place on these cases? There is no judgments being made on who will be admitted or not admitted, that these people are in fact purchasing pre-purchased tickets on the airlines and are having to cancel and pay that money, that there's no assessment being made by the Ministry of Health, that they're getting no calls from doctors, no calls from hospitals, no calls from the Ministry of Health, that the situation's under control.
Order. Order. Question's been asked. Premier.
Mr. Speaker, the honourable member is making some serious allegations against the medical profession, and he's entitled to do that in this House. But, Mr. Speaker, they still have professional responsibilities, and in spite of the inconvenience at the moment, we believe that they're still fulfilling their professional responsibilities in that particular regard. Now, if you have evidence of someone who's irresponsibly treated by a physician, I know that the college would very much like to hear about that situation. Now, with respect to your second point, about the inconvenience to people in Northern Ontario, and that is a real problem, perhaps, Mr. Speaker. Well, I'd be very happy to give an answer if you'd like one. Well, Mr. Speaker, if we can assist those people that you are aware of under our Northern Travel Program with respect to inconvenience, let me assure you this government will do everything it can to assist those patients and compensate for hardships in these circumstances. And if you have people that are aware of that, have suffered those difficulties, please bring those names to our attention. We'll make sure that they don't suffer.
New question. Order. New question, the member for Bellwoods.
A question for the Minister of Labour. Given that tomorrow the Workers' Compensation Appeal Tribunal begins hearings on the Villanucci case, which is a historic leading case before the tribunal, wherein one of the issues will be the meaning of Section 45(1) of the Workers' Compensation Act, the section that establishes ratings for permanent injuries. I want to ask the Minister why the Director of Medical Services of the Workers' Compensation Board, on the eve of this hearing, Dr. Dowd, would uphold the use of the meat chart by the Workers' Compensation Board in its interpretation of that section of the Act, and why he would make the ridiculous statement that board doctors use, quote, universal medical guidelines when it comes to dealing with back injuries, unquote, and that socioeconomic factors is not our business. Why? Can you explain if this is government policy, this palpable nonsense from your medical director?
Minister.
Well, Mr. Speaker, I gather the honourable member is referring to the comments which were contained in yesterday's Toronto Star article. The issue of whether the payment of a permanent partial pension shall be for pain and suffering only or for loss of income is an issue which is fundamental to the appeal, which is beginning tomorrow, as the honourable member points out, before the Workers' Compensation Appeals Tribunal. I think the honourable member would know, Mr. Speaker, that in the past the payment of a permanent partial pension has not in any way been involved in the loss of income. And indeed, that's been an area which I know the honourable member would be aware has been widely criticized, and which brought forth the first Weiler report and the recommendations contained therein. We are waiting for Professor Weiler's second study on this matter, a new study which he is undertaking for the ministry. We expect it by the end of this month. And meanwhile, we'll be watching this appeal before the Appeals Tribunal with interest.
Supplementary?
Yes, the minister didn't answer the first question, but I asked by way of supplementary, why on earth would the Workers' Compensation Board retain J.J. Robinette to represent its case before the tribunal in the Villanucci case, when the minister knows perfectly clearly that the position of Mr. Robinette expressed for the previous government was that this hideous meat chart, this ridiculous and unjust travesty of a meat chart, is the correct interpretation of Section 45(1). Why is the government taking that odious position tomorrow during the Villanucci case?
Minister?
Well, Mr. Speaker, first of all, that is a position, the decision to hire Mr. Robinette is, I assume, a decision which was taken by the independent board of directors of the Workers' Compensation Board. Mr. Speaker, it is the honourable member. Mr. Speaker, the honourable member would know that we on this side have raised questions as well, with the about the future of the meat chart and about the efficacy of its use in the future. Until, however, new legislation comes forward, and indeed until all members of the legislature have a chance to review the findings of Professor Weiler, that is the method of determining permanent partial pensions which is now in place. And I think the Mr. Robinette, Mr. Speaker, will probably be placing the argument before the appeals tribunal that the interpretation that the board has always put on the meat chart is the correct interpretation.
New question, the member for Wellington South.
Thank you, Mr. Speaker. Mr. Speaker, I have a question for the Minister of the Environment. Mr. Speaker, I don't know why the Tories are heckling me. The question deals with waste management, and it's along the lines of the questions they've been asking this afternoon. So, I don't understand the reaction.
You're not going to ask the question?
Ready? Okay, I will now. Well, I didn't want to interrupt their playtime.
Question?
Romper room. Mr. Speaker, the question is not only of interest to me, but certainly the member of Wellington Dufferin Peel. As the Minister of the Environment will know, the City of Guelph and the County of Wellington have undertaken a significant and massive waste management study for the last several years, costing a lot of money. As the Minister will know, the report is out. And essentially, the two recommendations are either to expand the existing site or to create an energy from waste plant in the City of Guelph, particularly the University of Guelph. Could the Minister tell my constituents who have been calling me regularly what his ministry's position is as far as the energy from waste plants being created in Ontario, with specific reference to the one at Victoria Hospital in London?
The options that have been available to all of the municipalities in Ontario who have come forward with their waste management plans have been a number, but the basic choice that they have in terms of the disposal of the large majority of their garbage has been the option of either incineration or landfill. And both, Mr. Speaker, have their proponents and opponents, and in the area represented by the member for Wellington and some of the adjacent people. The ministry is prepared to look at all of the proposals which are put before it for the disposal of what we call municipal garbage and evaluate them. I should note to the member that there has been some considerable interest in incineration of garbage in very recent times because of some reports that have come out, and our ministry is looking extremely carefully at all of those proposals now. We have, of course, up to this point in time, required that the best available and latest available technology be installed in any of them. There are still those who see that as not being sufficient, and so we will have to evaluate everything when we take into consideration the proposals put before us.
Supplementary.
Thank you, Mr. Speaker. Mr. Speaker, through you, could the Minister tell me, please, what kind of results he has experienced from, if any, from the energy from waste plant at Victoria Hospital in London? And second part of the question is, what promotions for recycling is his ministry involved in?
Minister?
Well, the first answer I can give to him is that we have looked at a number of incineration situations in the province to determine how well they're working, and the one is extremely recent, of course, at Victoria Hospital in London. And I must say that the evaluation of incineration as one of the options now must take into consideration not only our experience in the past, but what we determine can be done in the future. There's one in Prince Edward Island, for instance, which is of some interest to people, and testing has been done, and one in Quebec. But we want to ensure that the best available technology would be there or we could not accept that if it did not remove the products that we do not want coming out in the atmosphere. Very briefly, in terms of the new program for recycling, it is tied, of course, to the new regulation which is related to pop cans, and there's considerably more money come into that and considerably more promotion of recycling. We see it as an important component of dealing with municipal landfill problems in the future.
New question. The member for
Thank
Brantford.
you, Mr. Speaker. My question is for the Premier. Mr. Premier, 12 days ago in this House, I asked regarding the $17.5 million grant to the Exploricom project, if you would be willing to share with this House anything and everything you might have that would dispel the impression that the Schwartz submission got special and extraordinary consideration from the government. 7 days ago, I put questions on the order paper asking if you would table the submission made by Mr. Schwartz to the Technology Fund, the minutes of the Council of the Technology Fund. Mr. Premier, you have to date not tabled any of this information or brought any of this information forward. My question to you, sir, is what are you afraid of? Why will you not make this information available to the House?
Premier?
I'm not afraid of anything, Mr. Speaker. I told you then. You know, Mr. Speaker, we're very happy to share the information. There are no minutes of the council. I haven't maintained that there are. You see, I'll just go back through this. Well, just wait. The person you should be talking to, if you want some of the information, is the former Minister of Industry and Trade, because it came to the government when he was the minister, the honourable member from Sarnia. And he's aware of this, and it all came through the bureaucratic process. Well, I'll tell you this. Well, but the honourable member was aware of the submission, and it came to the government. It came up through the system. It was approved by a group of included in the throne speech, and we're happy to share that. Now, I was under the impression that you want to discuss this at Public Accounts sometime. Very happy to discuss it. But sure, we're happy to share this information. There's no problem whatsoever. And as you said, you support the process. I recall you standing in the House and say you support the project. You think it's a good one. And the bureaucratic review of the situation, we supported the project. The honourable member will be aware of that. I suspect when you know more about it, you will stand up and say this is the most wonderful thing this province has ever had.
Supplementary.
It is. Thank you, Mr. Speaker. I say by way of supplementary, I was under perhaps the rather naive impression that the person I should question about this is the chairman of the Premier's Technology Fund, the Premier. Now, I ask you, sir, you say there are no minutes. You have given the House no indication of what process was gone through for the approval of this grant. Officials of your government are continuing to tell me that there is no process, no criteria, don't bring any projects forward, there's nothing there till the fall. Now, will the Premier come clean with the House, put everything on the table as to how this grant was made and who approved it?
Premier.
Mr. Speaker, very happy to. I mean, I thought we'd answer this 2 weeks ago, but I'll answer it again. It came into the ministry in a couple of 1985. It was reviewed by the ministry. At that point, there was no technology fund. This was not a direct application of the technology fund. It was a project that was in the mill from previous governments. It fit perfectly with our objectives, and Cabinet approved of the expenditure to conform with our new plans under the technology fund, and it was budgeted to the technology fund. It's quite clear. I told you that 2 weeks ago. It's hard to understand, I know, but that's what I told you.
Order.
And so I've also told you that was the budgetary allocation. It did not exist when the thing came in, and it's all there for people to see. Now, I don't think that's that hard to understand. It may be, but it's not that hard to understand.
Order. 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 New question, the member for Scarborough-Ellesmere.
Thank you, Mr. Speaker. I think you should send the phone back, and then Phil can call Andy, and all the Tories can call for help.
Question, please.
I have a question for the Minister of Colleges and Universities, and I raised the plight of Mr. Richard Gerson, who was a faculty member at Sheridan College. Since Mr. Gerson's dismissal, at the very least, has the appearance of being in response to his participation as a candidate in the last provincial election, will you as minister conduct a full inquiry to determine if Mr. Gerson was dealt with fairly by Sheridan College.
Minister?
Well, Mr. Speaker, the allegations that the member makes are rather serious ones. I haven't had any information about the dismissal or hiring of faculty members at Sheridan College. Indeed, I, as minister, nor my ministry do not review hirings and firings. That's the responsibility of individual colleges. I am shocked at the allegations. I'll certainly look into it and report back to my friend if there is any sense of wrongdoing, but I would be very surprised to hear that a member of a college faculty was dismissed because of his participation in a provincial election.
Supplementary?
Supplementary. I'm surprised, shocked, that the minister is shocked, since I understand that part of Mr. Pittman's mandate, and certainly flowing from the Skolnick report, there are concerns about managerial processes at work in the colleges. And I would ask him that in that light, and assuming that the government wants a fair and objective and not an arbitrary managerial process in the colleges, will you at least conduct a full study of the process used in the Gerson case and then report the findings back here to the House?
Minister?
Well, Mr. Speaker, as I've already said, I will look into it, but I'm not about to suggest to my friend that I'm going to launch a full-scale inquiry. I mean, the fact is that colleges are hiring and firing all the time. Indeed, with the new contract just being put into place, we expect substantial new hirings. But there also is a need periodically for a faculty member who's not living up to his responsibilities and the standards in the colleges to be relieved of his responsibilities. So while I will look into it, I certainly will not endorse the comments of my friend now that there has been some sort of impropriety. If there is, I'll report back to him.
The Solicitor General has a response to a question previously asked by the member for Carleton Grenville.
Mr. Speaker, on Monday, June the 2nd, the member for Carleton Grenville asked why the Fire Marshal's office had not acted with regard to repeated complaints, deficiencies, and fire violations in both Ingersoll and Woodstock courthouses. There is no courthouse in Ingersoll, and I assume that the member was referring to the courthouse in St. Thomas. That building is owned by the County of Elgin. The Ministry of Government Services, who leased the building, requested a fire safety inspection last fall. That inspection was carried out by the local fire department. The responsibility for inspecting local buildings, including courthouses, is a local one. The Woodstock Courthouse is owned by the County of Oxford and leased by the Ministry of Government Services. An inspection was originally conducted by the local fire department in 1982. We now have an updated re-inspection since the matter was brought to my attention as a result of a new inspection. Those earlier inspections confirmed that there were deficiencies, notably with regard to the fire alarm system and exits. Fire safety deficiencies are normally corrected through voluntary compliance by the building owner. If enforcement procedures are necessary, the local fire inspector serves an order on the building owner. The fire marshal is made aware of all orders that are issued in the province. No orders have been made by the local fire departments against either of the two courthouses in question. However, fire marshals encourage local fire departments to notify his office when they're proposing to take enforcement action with respect to any building owned or leased by the Ontario government. The fire marshal then acts as a liaison with the Ministry of Government Services and takes steps to ensure that the fire code's complied with. In the case of these two courthouses, the fire marshal has agreed to liaise with those two counties in question.
I'm going to add 1 minute to the question period because of the length of that statement. New supplementary. Order.
Mr. Speaker, I'd like to thank the Solicitor General for his answer. It's indisputable that the Attorney General, through the Ministry of Government Services, is the lessee. Number one, does your lease does the lease of your government not state that the building has to be up to regulations? Number two is under Section 3C of the Fire Marshal's Act, you, Mr. Minister, are ultimately responsible for the safety of that building. You cannot duck it under the local officials. When are you going to bring this matter to be rectified so that the safety of the clients of the court houses in both Woodstock and St. Thomas are in fact safe? When are you going to take some action?
Minister?
The action I've taken is to ask that both of those facilities be re-inspected by the local people, and as soon as that inspection has been carried out, which it was just on the last Friday, to give us the report, and it will be studied by ourselves, and we'll gladly assist in recommending any changes.
The member for York East. Member for York East. Oh, no mic?
Mic's not on.
Okay.
Mr. Speaker, my question is through you to the Minister of Citizenship and Culture. Mr. Speaker, I have received a number of calls with concerns about the new federal tariff of 10% imposed on books coming into Canada from the United States. And as you know, this affects not only American books, but also most British and Commonwealth books, and also books written by Canadian authors that are published in the U.S. and overseas. And my question to the Minister is what are the implications for this very important cultural industry in Canada of this tariff?
Minister?
Thank you very much, Mr. Speaker. The implications of the federal government's actions are indeed broad. It's believed that the action was taken in retaliation to the issue on shakes and shingles. There's also some indication that it's also a symbolic reminder to the Americans not to tamper with our cultural industries. There are some concerns that action, however, has an effect on our exemption to the U.S. copyright legislation, which permits Canadian printers to export more than $100 million of U.S. authored books. There is a genuine concern by Canadian publishers who are involved in joint ventures, however, that they will be losing dollars in the case of reduced profits for pre-sold books. As you know, Madam Member, the provincial government has made it very clear that we are concerned about cultural industries, and at the point at which this issue, should it ever be brought forward to the free trade discussions, I'm sure we'll make our representations known. Thank you.
Order. Order. Supplementary.
Yes, Mr. Speaker. Mr. Speaker, I understand that not only are bookshops required to pay an additional amount of 10% for the tariff, but also on each $100 of an order of books, a further $28 in customs brokerage fees. I also understand that our legislative library may well not be exempt because it's not a lending library.
Question.
Could I ask the Minister through you
Question, please.
What action can Ontario take in this regard?
Minister?
As I've indicated to the member, I presume that the government will be sought for input during the free trade discussions. It was not our responsibility to respond formally during those isolated instances, but now that the free trade discussions are on again, we will conform. Certainly the responses of the Canadian Book Publishers Council and for publishers such as Malcolm Lester has been received by the federal government, and I presume Mr. Reisman will take those kinds of input into consideration in the negotiations.
Yeah.